to workout number 5 of 25 for December monthly movement challenge. For this workout, we have 3 rounds of 30 seconds each of a Pallof press with 30 seconds per side, Bulgarian split squat, and then Copenhagen plank for 15 to 30 seconds per side. With the Pallof press, you're going to start with the band around chest level attached to whatever structure is nearby. We want to ensure that there's tension in the band, so you may need to move a little bit further or closer to that point of attachment. You can place a ball between the thighs and then exhale to squeeze as you push the band straight out and maintain your body position, and then inhale to bring it back in. Next up, we have the Bulgarian split squat. So you'll place one foot onto an elevated surface behind you. Inhale to lower down, reach forward so we find internal rotation. So think belly to thigh at the bottom of the movement. Exhale to stand up. Keep weight in that front foot, and we want to maintain a little bit more of an upright torso position as you do this movement. If you find the Bulgarian split squat is too much, we can do just a split squat with an option to attach a band to emphasize the adduction. So placing the band around the leg, we're going to step the legs out and ensure that they're in separate lanes, and then inhale to lower down, and then same thing. We want to find that internal rotation at the bottom. So rotate belly towards thigh as you lower down, and then exhale to come on up. In this movement, we want to focus on keeping more of the weight in the front leg. Next up, we have the Copenhagen plank. So you'll place the leg on top of an elevated surface such as a bench or a table, and then the bottom leg you're going to lift up. So it's the top leg inner thigh that's going to be working to help you maintain this position. You can squeeze the two legs together. If you need some support, you can bring that bottom leg down to the floor to aid with some stabilization. If you find that this is too much, we can do a floor variation. So the top leg is still our work leg. Place it down on the floor and then lift the hips up. You can either lift the hips up and down, or you can maintain the hold at the top. To make it a little bit easier, you can see how I'm crossing my legs together here. This is going to make it a little bit easier, or you can just hover the leg out to make it a little bit more challenging. If you want to make it more challenging, place a weight on that lifted bottom leg as well. Another option is to place a Pilates ball or a pillow or something soft between the thighs, and we can do sideline hip abduction with a ball squeeze. So this is still going to emphasize that inner thigh activation, but in a way where you have a lot more support. So you'll exhale to push the hips forward to find full hip extension in both hips, and then inhale to lower. Starting round number 1 with that Pallof press. So bring the band to be around chest level, bring it to the center of the chest, and you exhale to push it straight out. Exhale to push that band straight out, maintaining midline, and then inhale to bring it back in. So we want to be resisting a pull towards that point of attachment. So you should feel like you're resisting being pulled laterally or rotationally. So exhale to push that band straight out, and then inhale, bring it back into the chest. Go ahead and switch to the other side, so you're going to face in the opposite direction and bring that band to the center of the chest. Exhale to push that band straight out, maintaining midline as you extend the arms, and then inhale to bring that back into the chest. So again, resisting that pull towards the point of attachment. If you have a Pilates ball between the thighs, think exhale to squeeze that ball as you press the band straight out. Next up, we have the Bulgarian split squat. So placing your foot back on an elevated surface, front leg is going to be your working leg. Inhale to lower down, find internal rotation. So choosing between the Bulgarian split squat or the banded split squat, inhale to lower down, think belly to thigh to find that internal rotation. As we find that internal rotation at the bottom, this is important because it's finding more length in the glute, which is going to help to strengthen it more. And the glute med is what helps with that single leg stability, which is going to support pelvic stability. So as you lower down, really focus on keeping that knee stacked over the ankle. There may be a tendency for it to want to fly outwards. And you can also keep weight in that big toe side. So let's go ahead and switch sides now. So switching the legs to the opposite leg as on the elevated surface, or switching the stance if you're doing the split stance instead. Inhale to lower down in your lunge, and then exhale to come on up. As we lower down, again, we want to focus on finding that internal rotation to find more length in the glute. So at the bottom, you should feel a big stretching in that glute and hamstring. This is going to bring more range of motion to that glute, which is going to help strengthen it more to aid in single leg stability, aka pelvic stability. So keep weight in that big toe sides, keep knees stacked over that ankle, exhale, come. Moving on to the Copenhagen plank, choosing your variation that works best for you. It's okay to not do the most advanced variation, which is with the bench. So coming onto your side, choosing either the floor variation, the bench, or even the ball squeeze, which we are not showing in the video here. Exhale and just hold yourself where you're at, and then just breathe as normal. If you want to, you can lower the hips up and down. If you're using the bench, really think squeeze the legs together. If you need some rest, bring that bottom leg down. Once we hit 15 seconds, you can go ahead and stop and rest, or you can keep going for as long as you can. 30 seconds is a long time to hold this. Go ahead and switch to the opposite side now. And then come on up to your position and hold, or you can lower up and down as needed. As you hold, really think squeeze the legs together. The higher the bench or the elevated surface is on your leg, the easier this movement is going to be. So if you find that it's too intense, bring it up more in the upper thigh. If you find it's too easy, put it more on like the shin or the ankle, for example. Moving on to round number 2, back to that Pelvic press. So grabbing that band and bring it to the center of your chest. Exhale, push straight up. Exhale to push that band straight out. If you have a ball, think squeeze the ball between your thighs, and then inhale, bring it back to your chest. And so again, we should be resisting a pull towards that point of attachment. If not, step a little bit further from the point of attachment. If you find that you cannot resist rotating, step a little bit closer. Switching to the opposite side, so facing the opposite direction, and then exhale, push that band straight up. And exhale to push that band straight out. Inhale to bring it back to the center of the chest. As we push straight out, ensuring that the hands stay aligned with the center of the chest, feeling that pull towards the point of attachment. And you should feel this mostly in the side core. Moving on to the Bulgarian split squat, placing that foot on an elevated surface. Inhale to lower down, finding that internal rotation. So the internal rotation portion of this movement is really important, especially for all our single leg glute focused movements, because this is going to bring more length to that glute, which is going to strengthen it overall. Internal rotation is typically neglected when it comes to fitness programming, and so if we're having pelvic girdle pain or discomfort, it could be because we haven't found enough length in the glute. So the glute med is going to help with single leg stability. So inhale, find that internal rotation. You're going to feel this big stretch in the glute and the hamstring. Exhale, come on. Switching to the opposite side now, so placing the other foot on the bench behind you. Inhale to lower down, finding that internal rotation, keeping weight in the front foot. So think weight is in the big toe side of the foot. Sometimes there's a tendency to roll to the outside of the foot when we're trying to find internal rotation as a compensation pattern. And then think knee is staying stacked over the ankle, and then we're rotating belly to thigh. So think about your pelvis rotating on top of that femur head as we find that internal rotation. Moving on to the Copenhagen plank. So coming in either to the bench variation. For the bench, the higher it is up the leg, the easier it is, or the side plank variation. So forearm is down on the ground. Top leg is our work leg because we want that inner thigh to be working. Exhale to lift the hips up, and then inhale to lower down, or just maintain the position the whole time. If you need extra support, bring that top leg down towards the floor, and this is going to help you find a little bit more ease in this movement. Switching to the opposite side now, so bringing the other leg on top of the bench or down. Exhale to lift up and then maintain this position or lower the hips up and down. Moving into our final round, back to that Pelvic press, bringing the band to the center of the chest. Exhale, push it straight. Exhale to push that band straight out. Inhale to bring it back to the center of the chest, maintaining midline the entire time. So we're trying to resist a rotation towards that point of attachment. Go ahead and switch the opposite side now. So bringing that band to the center of the chest. Exhale, push it straight up. Exhale to push that band straight out. Inhale to bring it back to the center of the chest. So as we push the band straight out, you should really be feeling the side abs turning on as you're resisting this pull towards the point of attachment. Moving on to that Bulgarian split squat or split stance variation. Inhale to lower down, find that internal rotation, so think belly to thigh, keeping weight in that front leg, and then exhale to come on up. Inhale to lower down, keeping weight in the big toe side, knees staying stacked over that ankle so that knee is not pushing outwards as we rotate that pelvis on top of the femur. Exhale, come on up. Go ahead and switch sides now. Inhale to lower down, finding that belly to thigh position for that internal rotation. So feeling that big stretch in the glute and hamstring, and then exhale to come on up. Really keep that weight in the front foot. Exhale, come on up, keeping weight in that big toe side, knees staying stacked over that ankle. Exhale, come on up. Moving into our final movement, that Copenhagen plank. So placing that top leg on a bench or on the floor, and then bringing the hips. Exhale to lift the hips up or to maintain the position the entire time. If you're maintaining the position, just breathe as is normal. If you're lowering and lifting the hips, exhale as you lift up, inhale as you lower down. Switching to the opposite side now. Exhale to lift the hips up and then inhale to lower down if you're lifting and lowering the hips. If you're just going to maintain the position the whole time, just breathe as is normal. And this concludes workout number 5. If you like the workout, please subscribe and like and comment below.